Hi, I'm Jack Parker with Parker Cornea, and if you're watching this video, it means that you have been referred to us for the possibility of an implant lens exchange. You know, when you have cataract surgery, virtually everyone has a new implant lens put inside their eye to take the place of their old natural lens. And usually, this lens remains in place and is clear and functional and perfect forever. It's really uncommon, actually, to need to replace that lens for any reason. But it happens. There are things that can rarely occur in which that lens that was placed, it turns out that it's not the right power. There are various reasons why that could be the case, but rarely the lens that was put in is not the right power. Or the lens goes in and it's the right power, but ends up in the wrong place inside the eye. Or even more rarely, the lens is the right power in the right place, but over time, even the implant lens can wear out in a small subset of people. So the bottom line is there are a few weird things that can cause problem with an implant lens placed for cataract surgery. Even though these are really rare, the good news is when we see them, we can usually fix them. And the way that this is done is by replacing the implant lens with a new one. Now, what type of new lens and how we replace it, it's extremely variable. It depends on the patient. It depends on your unique circumstance as to what the game plan should be in terms of taking that lens out and putting in a new lens. But regardless of what the specifics of that plan will be, generally, here are the things that you need to know. First, these lenses that are put into the eye are meant to go into the eye. They're not meant to come out. That means a lens exchange is an inherently complicated, complex operation. It's an operation that most eye doctors don't do or aren't trained to do. So any lens exchange means you're already having a complicated surgery. When you have a complicated surgery, that means that we always take a lot of care during the operation. Usually cataract surgery takes 5 or 10 minutes. A lens exchange can take 30 minutes or an hour because it's a careful, delicate, deliberate operation. It means your healing is usually longer. The cataract surgery, you're healed in 2 weeks. A lens exchange, it may be 2 months before you have your best final vision. The risks of lens exchange are greater than the risks of the original cataract surgery. You can have bleeding, you can have infection, you can also have retinal detachment. Retinal detachment is a problem in the back of the eye that results from surgery in the front of the eye. It almost never happens with regular, straightforward cataract surgery, but the risk with lens exchange is about 1%. So the thing to keep in mind is not to be afraid of this operation. I'm not telling you this to scare you, but I'm telling you things that I would want to know if I was in your position. That a problem with an implant lens is rare. It's almost always curable, but the surgery typically takes longer and is going to require us to be very careful in observing you after the operation to make sure you heal well and get the very best possible vision. So if you find yourself in a position in which you need this operation, I think we probably can help you. I think this may be something that you would really want, but we should talk together and work as a team to make sure you get your very best results.